Hi, Todd Martin here with the Walking Code. Thanks for joining me for lesson number 10 of the Walking Code Core Technique lessons. In this lesson, we're going to discuss how the core techniques apply to our posture. This is really important, and it's a great concept to understand that the core techniques, or how we use the three elements of our core when we're moving, also apply when we're standing still, because we never disengage our core muscles. People will often talk about engaging your core muscles, like tightening them up. Tightening your core, other than trying to show off a six-pack, doesn't do anything in terms of creating posture or creating movement. Movement is what creates movement. If I want to move my arm, I'm going to just flex my bicep muscle and it's going to flex my arm. I don't squeeze or tighten my bicep muscle if I'm trying to move my arm. I simply use the bicep muscle to make the arm flex. If I squeeze the bicep muscle, what I'm really doing is tightening my bicep muscle and my tricep muscle against each other, creating internal tension. And so that is not necessary for moving the arm. It's also not necessary for creating proper posture. We don't need tension in the abs or any part of the core to create a nice, perfect, relaxed posture. What we need to do is have the proper movements going on. The proper posture when we're standing, or the core technique we're going to be using, is the core technique of lift. If you watched the previous lesson on the core technique for stopping, you will already understand that the core technique for being in a stopped position is lift. Lift is torsional rotation of one side of the core, flexion of the hip on the same side. Let me briefly go over going from a walk to a stop. I'm using my upper torso on the left, turning forward to place the left heel. Now I'm going to tuck the pelvis on the left using my lower abs, and at the same time I'm going to flex my left hip, and that's going to bring me up to a risen position over my left leg, and then I'm going to switch all of this energy from the left over to the right by turning forward on the right, tucking on the right, and lifting, flexing my right hip. Now I'm engaged in lift on the right, and I have perfect posture with the center of gravity lined up directly between the 2 feet. But my root is on my right. It's just difficult to see that if you don't understand how the core technique principles and movements apply. But that is how my core is being engaged to create this posture. I never stopped moving. Remember, I'm actively turning forward on the right, actively tucking on the right, and actively flexing my right hip. And I still am. It just creates this equilibrium position where the movements are still going on, but they cease to move any part of the body. I'm not going to disengage any of those muscles, or I will just drop to the ground. We always have to have the muscles engaged, but I am not squeezing them against anything. I am engaging them to support my body against gravity and allowing the structure of my spine also to hold the body up. From the side view, creating that posture using the lift technique on the right, you can begin as a practice by flexing your right hip so your knee is forward, right toes are on the ground. Turn your upper part of the core on the left side over to the right, and then tuck your pelvis on the left. So now you're engaged in set right. Flexion of the right hip, torsion on the left side of the abdomen. We're going to use this as a starting position for the exercise to get that standing posture correct. We're going to turn actively with your upper part of the waist and tuck your right pelvis using your right lower abs. Your right hip was already flexed, so you don't have to do anything with your right hip. That's going to bring you into this position, with it, which is normal posture. Torsion on the right, flexion of the right hip. What are the things that are going to cause incorrect posture? Well, it's going to be improper activation of any part of the core is going to lead to improper posture. First, let's start with this. We are turning the upper part of the core, and that is keeping our posture vertical. But some people move not by turning, but by tilting, using both sides of the upper part of the core, which is going to cause the body to fall forward. There's always going to be a compensation for that because, of course, people are not going to let themselves do a pratfall under their nose. So the compensation for this forward lean is pulling the lower back muscles backwards. And so now I have a tilt of the upper torso and the back is pulled backwards. So that is going to be an improper posture caused by leaning forward using the upper abs instead of turning with the upper abs. Now, most people are not going to stand that way unless they get much older and the muscles get fixed in this position. What's more likely going to happen is they're going to use the upper back muscles as a compensation for this lean, and then stand like this, which may appear like a military posture. I am pulling back with exaggerated force with my upper back muscles to compensate for that forward lean. So now it appears that I might be vertical with my posture, but I'm actually have a tilt forward of the pelvis, and I have an exaggerated arch in the lower back because I'm pulling back from the upper back, not maintaining vertical posture with the whole spine. So that is not vertical posture. This is a very big strain on the lower back, which can lead to back pain. So that's one of the things that's going to happen when we use the upper part of the core incorrectly when we're standing. Now let's talk about what's going to happen if we use the lower part of the core incorrectly when you're standing. I'll back up a little bit so you can see the whole body. In the standing position here using lift, I have engagement of my right lower abs, not my left lower abs. If you engage your left lower abs at the same time as the right, it's going to over tuck your pelvis, pitching it backwards, and pull the weight forward. Because remember, we used our lower abs, if we're changing weight to this foot, the lower abs help pull the body forward to that leg. If I engage the lower abs on both sides, it's going to tuck the pelvis too much backwards, and it's going to keep pulling the body forward until you fall over like that. Which, of course, again, people are not going to let happen. So how do they compensate? They compensate by removing the forward motion from the upper part of the core, which is also turning forward. So instead of letting myself fall forward because of the lower abs, I disengage the upper abs, and now I have this position. Now I have this slouched posture, which is hollow here in the upper part of the chest because I'm not engaging my upper abdominal muscles. And I have this overly tucked posterior pelvic tilt on the lower part. And you'll also see that my hands roll forward in this position. So this is bad posture, also strains the back, and it's also going to contribute to rotator cuff symptoms because my shoulders are not in the proper position. And that is what's going to happen with improper movement of the lower abs. So, to keep it simple, keep proper posture by using the proper combination of core muscles, not simply squeezing the core muscles, because squeezing the core muscles doesn't do anything. We need to use them to move the body into the proper position in a relaxed fashion. I can have lift on the right, torsional rotation here on the right, flexion of my right hip. I can shift that to torsion on the left. Now I've shifted the torsion and my rooting to the left leg, flexion of the left hip. So you can shift yourself back and forth and try to feel how your core engages. Using the arm can help to feel where the upper core is reflected on that rotation. Use your upper arms to reflect the movement of the upper part of the core. You can use your belly button to stand in for your lower abs. Feel like your belly button is turning to the left when you're rooted on the left. Feel like your lower abs or your belly button is turning to the right when you're rooted on the right. And that's how you can kind of feel the core moving. But it's ultimately going to result in this standing position that looks like there's nothing going on here, but there is always something going on in the core. So I hope you enjoyed this video. If you did, click the like button and subscribe to the channel if you're not already a subscriber. Look forward to seeing you on the next video. Thanks for watching.